It all too, huh? Oh, yeah.
Okay, I think we're ready to go.
When we first began, there wasn't a lot of infrastructure, so basically we would get on a plane and go down to a hospital in the capital city of Belize that we'd formed a relationship with. So it was very, very basic at that point, and it was just Tim and I at that point.
The first trip was difficult. It was, logistics were very difficult, and just getting from place to place and making sure that we had the equipment that we needed to have.
I experienced something new down there, which was simply talking to somebody for 10 minutes and giving them your time and saying, I'm listening to you, let me see what I can do to provide advice, even if it's not operate. It meant the world to them. So some background, there is really one urologist in the country of Belize, and so to put that in perspective, they have, I believe, over 300,000 people. In the US, we tend to have about a minimum of a urologist per 10,000 people. What was more notable was, yes, there were complicated surgeries that needed to be done, but there were also very basic surgeries that weren't being done that in the US will be done as an outpatient in 5 minutes, but down in Belize can cause lifelong disability or even death, and that was really shocking to me.
My mom had been suffering from pain in her bladder for like about 6 years or more. And
he had a mass on his right kidney. We came to emergency here for the diverticular venosis, and they referred us to you. You guys were godsend, actually.
I was peeing myself constantly, that I had to walk around with a big purse with pads on, and every minute I had to change my pads because the urine was just coming down a lot.
At the beginning of the week, we all meet, and our first day is basically spent inventorying the equipment, getting it unpacked. So it takes several hours to get the equipment unloaded, make sure we have what we need for the clinics and the operating rooms, and so that's typically the first day. And then we have a big clinic.
Tell me what just hold on, sorry. So for the past couple months I've been having intense back pain. Okay, let's hold on. I've been having a lot of back pain.
Francella Menivar, number 5. Wiltshire.
When we arrive, we typically see a clinic of anywhere between 30 and 70 patients, just depends on who shows up. And after we've seen all the patients, generally the surgeons, whether it's Dave and I or whoever else is there, we will take all of the patients that we've seen that are surgical candidates, and we basically triage them, and we say which ones are the most critical, which ones are the ones that we are going to be able to make the biggest change.
At the end of each day, we call the patients that are on the schedule for the next day and let them know, and then we operate generally for 4 or 5 days, and we do as many cases as we can. Okay, put up your side. Great. Sorry. Next down.
probably still a little bit below it.
Over the years, we've developed a standard team for each mission. Again, it is a surgeon or two, typically two surgeons, an anesthesiologist, a scrub nurse, and a circulating nurse.
We learned how to do it their way. There's not an infinite number of supplies. We had to process stuff in ways that I've never done things before. And we get so used to being in this disposable society that we live in, where we throw everything away. There they save and reuse.
And of course, working with the local physicians has been critical. Now we have the support of local gynecologists, in particular, that I work with, and residents. Their residents, most importantly, follow these patients afterwards, make sure that their hospital stay is optimized, are responsible for seeing them afterwards, and that's really critical. We'll give her some liquids this morning, see how she does, and if she keeps cracking the gills, then she can go on. But tomorrow is going to be a regular diet. So every morning, what we do is we take all the patients that we operated on yesterday, and we go do rounds where we see them, make sure that they're doing okay, and come up with a plan for that day. You actually had a growth down there, benign, no cancer, but you had a big pocket that was coming off your urinary tract, and it had a lot of stones in it.
Yes, I have it right here.
Where are they? Little souvenir. There were actually, this is probably half. There were probably more. So this is what was causing the connection, and that's why you were leaking all the time. But we were able to, where are you going to put that? At your house? Carry it home? On this last trip, we had two missions running simultaneously. So one was up in Belize City, and one was 2 hours south in Dongriga, and that was really exciting because a lot of the people in Belize can't make the trip up to Belize, and so we had for our first ever mission there, but we chose to do them simultaneously.
We'll get you taken care of. There'll be, like I said, there's gonna be a little cut right there. I'm gonna sew everything up. There'll be some bandages on there, okay?
No, I got one for a hernia already.
Okay. Well, there's gonna be a bandage over that, and you just take that off after 24 hours. So tomorrow you can take that bandage off. Underneath, there'll be some paper bandages. Leave those alone. If they fall off, they fall off. That's fine. I'm going to give you some antibiotics for 3 days, and you just take ibuprofen. You can get that in the pharmacy. Ibuprofen, 600 milligrams twice a day.
A little warm in your arm is a good thing. It's normal.
180. That's a big one. Did you hear it?
Yeah.
One day we got a call from the doctor down in Dongriga saying that the camera didn't work, and that camera was necessary for bladder surgery. We have endoscopic cameras that we take out bladder tumors with and do prostate surgery, and they're actually absolutely critical for our surgeries. But we also got a call from that doctor saying that he had a patient that needed a more complicated kidney removal that couldn't be done down there because of the resources.
And I'm having trouble with the equipment. It's better not to use the equipment that I have unless I can get something different. And with your diabetes, I don't want to put you at increased risk, because that can increase the risk of infection. And I had some trouble with this last one just because of the equipment. So what I'm going to try to do is one of two things. Either may go do the Belize City, because they have some equipment there, or I might have them ship it down. I don't know just yet, but I don't think it's safe to do it today. Okay?
So we then arranged for him to get on a plane, fly up, and that patient to meet us up in Belize City so that that big surgery could be done. But at the same time, that physician told us that there were 3 surgeries, female pelvic surgeries, which is my specialty, and I was up in Belize City, but they needed to be done in Dongriga. So I jumped on a plane, got down there that night, and operated on those patients the next day. So that was a lot of bouncing around, and I think that is very common for each trip. So a lot of what we do down there is kind of navigating different things and trying to make them happen, and we do the best we can. Again, I'm happy it was a very smooth surgery, and at least she's going to do great. Just please make sure that she rests and doesn't stress it while it's healing and things like that. Okay. All right. I'm going to go back with the next case, but it was real nice meeting you and working with you. You're welcome.
Thanks, Doc.
You bet.
Thank you so much.
You bet.
Thank you.
Doctors come here to help the sick people. That's a big help for us. Because, for example, a surgery, some surgery costs $8,000, $10,000 in a private clinic, and sometimes you can't afford to pay that.
Now I feel really good, like if nothing happened. For real, I don't have no pain. That's really good.
I would really like to see this charity grow. I think we can accomplish tremendous things if we had more resources. I would love to expand our mission reach in Belize to include more of these rural communities. I think there is so much room to grow the surgical infrastructure through building operative facilities and providing equipment that could really change the lives of many.
I think at this point we are considered to be an invaluable resource to them coming down there. It started out with just 2 guys trying to come down and do what we can, and now I think they rely on our services, and to the point where we've been able to expand and send multiple teams down there now, multiple times per year, and hopefully we're going to be able to expand into other countries and other regions.
It's amazing what they did for me, for my life. Then this is me now.
We did the surgery, and now I'm free. I don't have to walk around with a big purse, and I don't even have to wear panty liners. So I'm doing great.
I'm good, and I already coughed and no accident, so I'm very happy about it. I really appreciate your help, guys. I hope that you guys can come back and help others.
Everything changed.
Yo, good.
Wow.